Nancy Schutter. I'm a student from Houston Baptist University, and me and my classmates are going to be talking to you about lung cancer. So lung cancer is a malignant tumor of the lungs, and it is an uncontrolled growth of abnormal cells that start off in one or both lungs. It usually is in small cells that line the head passages. First of all, what is cancer? Cancer refers to malignant tumors which can invade nearby tissue and can spread to other parts of the body. The two types of lung cancer that we have is non-small cell lung cancer, which is about 80% of the population, and it generally grows and spreads more slowly. And the second type we have is small cell lung cancer, which is about 20%, which generally grows more quickly and is more likely to spread to other parts of the body. So what are the signs and symptoms of lung cancer? Lung cancer is clinically silent for most individuals for the majority of its course. It may be masked by chronic cough that is attributed to smoking or smoking-related lung disease. Persistent pneumonitis, which is inflammation of the lung tissue, is one of the earliest manifestations, also causing fever, chills, and cough. The most common symptom of lung cancer is persistent cough that produces sputum. Chest pain may be present and may range from being mild to severe. Dyspnea and wheezing can be present if there is bronchial obstruction in your lungs. One of the late manifestations is anorexia, which is being really thin, fatigue, weight loss, nausea, and vomiting. Unilateral paralysis of the diaphragm and dysphagia, which is difficulty swallowing, are also examples of late manifestations of lung cancer. Lung cancer is the leading cause of cancer-related deaths in the United States, and it accounts for about 28% of all cancer deaths. An estimated 215,000 new cases of lung cancer are diagnosed each year. An estimated 360 Americans are living with lung cancer. Although the incidence and mortality rates for men have dropped in the past decade, a similar trend has not occurred in women. No genetic abnormality has conclusively been identified for lung cancer. Carcinogen in cigarette smoking is directly related to the damage in the DNA in the body tissue. And also there's a theory that says that people have different genetic carcinogen metabolic pathways in their body. African Americans have the highest incidence and are more likely to die than any other ethnic group. Whites have the second highest death rate, and Asian and Pacific Islanders and Hispanic men have the lowest rate. Most cases of the small cell lung cancer occur in individuals that are aged 60 to 80 years of age. Lung cancer also occurs predominantly in persons that are aged 50 to 70 years. The probability of developing lung cancer remains very low until the age of 39 years in both sexes. It then slowly starts to rise and peaks among those older than 70 years of age. The risk of developing lung cancer remains higher among men in all age groups after the age of 40. More men than women die from lung cancer. Men with lung cancer have a worse prognosis than women. Women develop lung cancer at a younger age than men, and women are more likely to develop small cell carcinoma than men. Inhaled carcinogens and air pollution in certain geographical areas contribute to the incidence of lung cancer. Several differences exist in lung cancer incidence according to geographical area. The highest incidence occurs in the United Kingdom and Poland, which have cases of greater than 100 cases per 1,000 population per year. The lowest incident rate occurs in Senegal and Nigeria, which is less than 1 case per 1,000 population per year. With increased smoking in developing countries, the incidence of lung cancer is expected to increase in the next few years, notably in China and India.
My name is Anna Laura Alanis, and I will be discussing the risk factors, detection, and prevention of lung cancer. Now, smoking is the most important risk factor associated with lung cancer. In fact, it is responsible for approximately 90% of deaths in men and 80% of deaths in women. Tobacco smoke contains 60 carcinogens, in addition to carbon monoxide and nicotine, that interfere with normal cell development. Tobacco smoke also is a lower airway irritant that causes changes in the bronchial epithelium. The risk of developing lung cancer gradually decreases when smoking ceases and continues to decline with time. In fact, 10 years after quitting smoking, the risk of developing lung cancer is reduced to 30 to 50%. The risk of developing lung cancer is directly related to total exposure to tobacco smoke. Side-stream smoke, also known as secondhand smoke, also creates a risk to non-smoking adults and children. Another risk factor for lung cancer is inhaled carcinogens, such as nickel, iron, uranium, arsenic, and air pollution. Exposure to these substances are common for employees that are involved in industries such as mining, smelting, or chemical or petroleum manufacturing. Smoking has a synergistic effect with these chemicals, which means that smoking plus exposure to these chemicals will increase your risk of developing lung cancer even more. Female smokers are more likely to develop lung cancer than male smokers. Now I'll be discussing detection. There are many different ways to detect lung cancer. One way is by taking a chest X-ray to identify a lung mass. CT scan is the single most effective way, non-invasive technique, and is often used in combination with MRI. A CT scan can identify the location, extent of masses. A PET scan is used to measure metabolic activity of tissue. Malignant tissue has higher metabolic activity than normal tissue. A biopsy is necessary for definitive diagnosis and is obtained by fine needle aspiration of the lung mass. Prevention. The best way to prevent lung cancer is to modify the risk factors, and the most important risk factor is smoking. So it is very important to prevent people from starting to smoke and to get smokers to quit as soon as possible. And this is done through education. Teens are more likely to start smoking, and most smokers begin smoking in their teen years. So teen education on smoking and its effects is very important. Nurses must also model healthy behavior by not smoking themselves. And they also should promote smoking cessation programs as well. Inhaled carcinogens should be avoided as well. So employees that are exposed to these carcinogens on a day-to-day basis need to wear protective wear such as masks.
Hello, my name is Alan Badrus. I'm going to be talking about treatment, management, and the care of lung cancer. So, treatment is usually based on if the cancer has spread, and patients have the best prognosis when the cancer is caught early and is localized to where it started. When the cancer is localized, surgery is indicated to remove the tumor. But when the tumor has started to spread, a combination of chemotherapy, radiation, and surgery has the best prognosis. However, if surgery is not possible because the tumor is too large, then chemotherapy and radiation can help make the patient comfortable and extend the life expectancy of the patient. Really, prevention is the best treatment. Radiation is the administration of energy particles from a large machine that destroy cancer cells. Usually it's always done in the hospital, and it's usually outpatient. It's used to treat both SCLC and NSCLC. The frequency of the radiation depends on if the cancer has moved a lot or if it's localized. The goal of radiation is to make the tumor smaller so surgery is possible. Some side effects are fatigue, swelling of the affected area, which is usually the neck, esophagus, or the chest, skin irritation, trouble swallowing, and hair loss. Chemotherapy is the use of chemicals to kill cancer cells, and they target cells that are actively dividing, which is usually in the bone marrow, the hair, nails, and cancerous tumors. However, they cannot discriminate between healthy cells and cancer cells. So they're kind of just going to kill a lot of cells. This is also in the hospital setting and is usually outpatient. It's the primary treatment for SCLC, and the goal is again to shrink the tumor so that surgery is possible. Some side effects are fatigue, anorexia, taste alteration, hair loss, diarrhea, constipation, and nausea and vomiting. And surgery is really what you want to happen if you have lung cancer. The surgeon does not want to leave any cancer cells inside the body, so some of the surrounding tissue will be removed as well. The options are a pneumonectomy, which is the removal of an entire lung, a lobectomy, which is the removal of a lobe, or lobes of the lung. And then you also have, if it's a very small tumor, then the removal of a segment or a wedge of a lung is possible. Lung cancer affects many aspects of health, and since there is no 100% cure for cancer, people often think of the diagnosis as a death sentence. This isn't always true. There are options that will help extend life expectancy and control symptoms of cancer. Depression is common amongst cancer patients, so the healthcare team needs to be aware of that and treat it. It's also hard for friends, family, and the patient to accept the diagnosis of cancer. And there's organizations out there that can help the grieving process. Also, a non-religious person may seek spiritual guidance because they fear death and they don't really know what's going to happen to them. So spiritual guidance from like a chaplain at the hospital can be necessary. Nausea is a common side effect of chemotherapy, and trouble swallowing is a side effect of radiation. So it is really important for patients having these treatments to eat a very healthy diet, because weight loss and anorexia can result. And after discharge, it is very important for the patient and the family to be in a smoke-free environment, because smoking will just make the cancer come.
Hi, my name is Amsel, and I'll be discussing the resources and rehab for lung cancer. So spiritual and emotional needs vary from person to person, depending on their age, the closeness of family and friends, access to healthcare, and other factors. There are many resources out there that cancer patients can look up, and they can be very useful for them. So the first one is Cancer Care, and this is a nonprofit organization that provides free professional support services for anyone affected by cancer. They work to individualize support for each person, and they offer help that best fits your needs now. The next one is Cancer Information Service, and this is actually part of the National Cancer Institute, and this is a source that can be used for the latest, most accurate cancer information for patients, their families, the general public, and healthcare professionals. And lastly, there's Cancer Hope Network, and this is a nonprofit organization that provides free and confidential one-on-one support to cancer patients and their families. They match cancer patients or family members with trained volunteers who have themselves undergone and recovered from a similar cancer experience. So all these resources can be utilized for emotional and spiritual support, and it can be very useful. And as far as rehab goes, after lung cancer has been treated, the doctor will outline a program of tests and visits to monitor your recovery and to check that the cancer has not returned. This includes regular physical examinations and cancer screening tests. ASCO, or American Society of Clinical Oncology, actually offers a cancer treatment summary and survivorship care plans. And this is for both small cell lung cancer and non-cell lung cancer. And this will help keep track of the treatment received and create a plan once treatment has ended. Some goals to have after treatment of lung cancer include maintaining a healthy weight, cessation of smoking, eating a well-balanced diet, performing moderate physical activity to help rebuild strength and energy level. Recovering patients, even those using oxygen, are encouraged to walk for 15 to 30 minutes each day to improve their heart and lung function. Your doctor can help create an appropriate exercise plan based on your